Hi there, my name is Sarah Erdely, and I am happy to be presenting to you about the professional role of MRT in my lens as both a medical radiation technologist myself, an instructor, and also a staff member at the CAMRT, or the Canadian Association of Medical Radiation Technologists. Today I'm going to present to you about the MRT professional context and include some resources from the CAMRT. One of the things I'd like to focus on is an aspect of legal and ethical issues that relate to the CAMRT certification exam for entry to practice. And I'd like to just sort of raise that there's an exam blueprint that can be found on the CAMRT website. And one of the competencies pertaining to professional practice as an MRT is practice in a manner that recognizes a patient's legal rights. So this is a very small section on the exam in terms of the number of questions that you'll be tested on, but there's a lot of possible content that they could ask you about. And additionally, some of this information is provincial. So although it may not be a focus of your certification exam preparation, which is for national issues, it's extremely important to your practice as an MRT to make sure that you are respecting patients' rights and aware of your responsibilities. So two key issues that I'll touch on later include informed consent and privacy and confidentiality. The new competency profile, which was published in 2019, organizes competencies according to 7 distinct roles that MRTs play on the healthcare team. This links the required competencies to roles MRTs play in patient care and service delivery, and it highlights contributions that MRTs make within the larger healthcare environment. You can visit CAMRT's website and find a competency profile, and that's where you'll find a description of each of the roles. And you'll also find a list of competencies that pertain to each role. Today, as mentioned, I'm going to focus on MRTs as professionals. And the elements and values of professionalism is what forms a fundamental foundation for MRT practice. It directs your decision-making, your actions, and it shapes how the profession is perceived. So what does it mean to be a professional? For an MRT, this means you are committed to providing the highest standard of patient care by acting with professional integrity and in accordance with ethical and legal responsibilities. It also means you take responsibility for your personal wellness and performance. How does this translate into competency? Competency can be thought of as your ability as an MRT to provide safe, effective, compassionate, and ethical patient care in a variety of work environments. This is a list of the key competencies of MRTs as professionals. Competencies are the behavioral outcomes that integrate your knowledge, skills, and abilities and judgment. These are not a protocol, and so the way these will translate in practice is that they require professional judgment, which means you have to take into consideration the context or the specific details of the circumstances the patient needs and the evidence that's available to you at the time. This also includes organizational policies and procedures that you must comply with. So this integration of your application of knowledge and skills is essential to safe practice. So let's have a look at the first two competencies in a bit more detail. So these competencies, that list that I just showed you, are called key competencies, and they can be broken down even further to what are called enabling competencies. So these are behaviors you're expected to demonstrate that contribute to you meeting the key competency. So before I show you the list of enabling competencies, based on what you know about the profession and your responsibilities as a healthcare worker, I encourage you to pause this presentation and think for a minute on how do you think you would demonstrate that you're adhering to legal and regulatory requirements. So let's just see how closely your assumptions lined up to the actual competencies. To help you better understand each of these, I'm going to give a few comments. So the first one is practice within your provincial scope of practice. A scope of practice statement describes the activities in which a practitioner is educated, competent, and authorized to perform. For individuals, the scope of practice may be influenced by a variety of factors, such as your experience, your continuing education, or even your employment setting. Within BC, there is no legally defined scope of practice for MRTs because MRT is not a regulated profession in BC. Therefore, it's the facility or the health authority level responsibility to define the practice requirements for the MRTs that they hire. The second one is comply with federal and provincial legislation and regulations. So the Canada Health Act is the foundation for the healthcare system in Canada. There's also a BC government website that contains information on BC's healthcare system, which includes some legislation. So you can have a look about BC's healthcare system. If you Google that, I'm sure it will turn up. This might be a good website for you to reference later or to have a look through just to get a little bit more information about BC. The next one is comply with the requirements of your provincial regulatory body. So as mentioned, there is no regulatory body for MRTs in BC. However, I would like to mention that the government has plans to improve the regulatory system, and we are working toward MRT regulation in the province. So it will be important for you to stay current with this. You should also be aware of the regulatory framework for MRTs in Canada. This will be covered in a little bit more depth in your professional preparation course that you will take in term 5. The last 2 items on the list is where I think it will be most beneficial to spend some time on for this course and for your current practice in the clinical setting, which is privacy and confidentiality, legislation, and informed consent. Before we move to discuss those specific issues, I'd like to touch on another key competency, which is apply ethical principles. So in your course, I'm guessing you've started to differentiate between law and ethics. So I'd like to put you through the same exercise that you did a moment ago. I'd like you to pause the presentation and just take a minute to think about how you, as an MRT, would demonstrate your ability to apply ethical principles in practice and what this list of enabling competencies might look like. So now here's the list of enabling competencies, and I'll just quickly touch on these. So I know that you've seen the CAMRT Code of Ethics already in other classes, such as patient management or other courses that you took in term 1. Informed consent, confidentiality, and many other patient rights are reflected in this code. From an ethical point of view, and according to the CAMRT code, this means you're making every effort to protect patient confidentiality. And this includes ensuring their physical privacy and respecting a patient's right to privacy of their own personal information. You're also respecting a patient's right to informed consent. One key issue you might be wondering is who sets the standards for healthcare? Who has the legal authority to enforce those standards, and where can healthcare professionals go for support on how to carry out their roles and responsibilities? By authority, I mean the person or organization that has the right to make decisions or enforce compliance. As you learn more about Canada's healthcare system, I hope you will also reflect on how different levels of authority impact you as an MRT. You should be aware that terminology is also really important. So policy is different than a guideline. I'll discuss privacy and confidentiality as well as informed consent in the context of legislation, policy, and guidelines. The health authority or facility that you practice at will have policies that align with legislation, and these policies will inform the departmental protocols and procedures that you are to follow. Again, because there's no regulatory body for MRTs in BC, as an MRT practicing at a facility in BC, your employer is the authority that sets your practice requirements. CAMRT, in its role as a professional association, provides resources and educational opportunities to help you. I've heard from many MRTs that often there aren't enough resources that are catered to them within their organizations. However, this could vary depending on where you practice. This is where the association plays an important role, and it's continuously building and seeking to understand what resources MRTs need. So this is beneficial to individuals so that they can improve on a personal level and they can help maintain a high standard for the profession. And of course, this will benefit patients who are receiving the best care possible. Two very important resources provided by the CAMRT are the Code of Ethics and the Best Practice Guidelines. These guidelines are considered reference material for your certification exam as well. So let's look at specific issues, starting with privacy and confidentiality. First, I'd just like to disclose that I'm not an expert in the law, and I welcome you to speak with your course instructor and seek out additional information about questions that you might have to go into a little bit more depth about legislation and that sort of thing. But what I will mention is that in BC, patients have the right to request records kept by hospitals, which are public bodies, and hospitals have a legal responsibility to ensure personal information is collected, used, disclosed, and securely stored according to the law. So these laws are set out in the Freedom of Information and Protection of Privacy Act. I'm going to give you another little exercise, depending on sort of testing your level of understanding of privacy and confidentiality. So first of all, I have three definitions that I want you to think about how you would define these terms, maybe just jot them down. So the first one's personal information, the next one's information privacy, and the third one is confidentiality. I want you to think about how you would define these. So feel free to pause. As far as personal information goes, that would be considered any recorded information that uniquely identifies you, such as your name, your address, your telephone number, your age, sex, race, religion, sexual orientation, disability, fingerprints, or blood type, etc. It also includes information about your health care and anyone else's opinions about you or your own views or opinions. Information privacy is the right to be in control of your own personal information. So who is it shared with, under what circumstances, and who can access that information? And then finally, confidentiality is the responsibility of keeping information secure. For MRTs, your responsibility is to respect and maintain patient privacy. And this also includes ensuring physical privacy and information privacy. You're also expected to keep information confidential. So if we just think about other ways MRTs can achieve this, one thing is to keep curtains closed during procedures, to monitor who enters the exam room, to discuss personal information with a patient in a private area, and to ensure confidentiality, you only discuss patient information with the appropriate healthcare providers. You should also be aware that a privacy breach is considered professional misconduct and could have serious consequences. Teaching and learning is a bit of a unique situation. For example, teaching cases or department rounds, we might be sharing patient details. There's a strict process to follow within an organization when it comes to using a patient's health record, including medical images for this purpose. And it's understood that preceptors or educators in their role need to view images potentially that students create for the purpose of evaluation and assessment. And that would be also written within departmental procedures, protocols, and policy. So information privacy, again, is the right to be in control of your own personal information and who is it shared with, under what circumstances, and control over the access to that information. Confidentiality, on the other hand, is the responsibility of keeping information secure. In addition to being a legal right, it's the ethical and personal value. And this might have different interpretations for each individual. So what's considered private to some may not be private to others. You should always keep that in the back of your mind when you're asking patients for personal information. It might be normal to you to ask certain questions, but it may not be normal to the patient. And you don't want them to misinterpret what you're doing as being unprofessional or inappropriate. Or worse, to have them walk away concerned that you breached their right to privacy. So it's best to always explain why you need information. AHLT has several key policies that pertain to the management of information. One of them is the Confidential Information Management Code of Practice. And employees and students at AHLT are required to take the CIM education module, and that's based on this policy. This is something that you have to refresh annually. There's a couple of other policies as well. And you can find a lot of this information within the intranet or the internal websites at Island Health as a student practicing there. You can also have a look at Island Health's Information Stewardship Access and Privacy Office. So they have a website as well, and they do have public-facing web pages just so that members of the public, patients, or whoever is visiting their facility has an idea how they're complying with legislation. A few best practice guidelines in the CAMRT BPGs touch on the issue of patient confidentiality. So you can Google this, or you can click the link on the slide that I showed you previously or at the beginning. So one of the guidelines is around patient-centered care. So respecting a right, or a patient's right to confidentiality, including requesting their permission to hold discussions with others present, such as family members, is part of that. And then under the suspected physical abuse guideline, for child abuse, the MRT has a legal duty to report, which overrides any duty of confidentiality. So those are just a couple areas in the guidelines that touch on this issue and kind of how that translates into your practice and your interactions with patients and where you would be responsible. I'm going to move on to the next topic, which is informed consent. So again, I'm not a legal expert. This is also just an overview. I know you had a module specifically on this topic already, so hopefully some of this is familiar to you. First of all, what is informed consent? A key goal of informed consent is to promote a patient's autonomy. Each patient has the right to decide if they want to participate based on ensuring their full understanding of the procedure and the risks. We can define informed consent in terms of the criteria that must be met for consent to be considered valid. So I do encourage you, once again, to pause, think of what these things might be, and then in a moment I'm going to list them off for you. In terms of ensuring that informed consent is valid, the following has to be true. So one is that consent is given voluntarily and it's not coerced. You actively ensure the patient understands what they're agreeing to. The patient must also be competent to give consent. So this means mentally and emotionally. So for example, a patient with dementia may not be capable of understanding, or a patient that does not speak the same language may need a translator. So these are things you need to consider. There's a couple of acts or legislations that apply in BC. One is for adults and one is for children under the age of 19. In BC, consent for healthcare is governed by the Healthcare Consent and Care Facility Admission Act. So as far as adults go, this act outlines the patient's rights, the required elements for informed consent, and when consent for healthcare is required. Also talks about the process for healthcare consent if a patient is determined incapable of giving or refusing consent. So in this act, an adult means anyone who's reached the age of 19. One website that you may not have looked at already is Seniors First BC, which is a kind of an association or nonprofit organization, I should say, that talks about seniors care, and they have some information about informed consent pertaining to this context. There's also a healthcare provider's guide to consent document that I have linked here that might just give you a little bit of different information that talks about BC specifically, and you may not find that otherwise in your textbook. And I'll just mention briefly that in BC, a child under age 19 may consent to their own health care if the child's capable. There's no set age when a child becomes capable. It depends on how mature the child is and what the medical treatment is. Similar to privacy and confidentiality, as an MRT, you're responsible to be informed about the policy at your facility. So you would have gone over this policy in one of your orientation modules or with your preceptor, maybe not in extreme detail, but it's always there if you need it. And if questions come up or a scenario comes up you're not sure of, the best thing is to learn and inform yourself and know that you will be responsible when you're practicing and what you're responsible for. And there's also several additional learning Hub modules that you can take a look at on the Provincial Learning Hub, which I've linked here. So even if it's not a mandatory training that you had to take, maybe there's something there that has the answer you're looking for. Touching on some of the profession-specific resources on this topic, CAMRT has a best practice guideline specifically about informed consent, and it explains that part of your role as an MRT is to ensure that informed consent has been granted by the patient for the procedure that is to be performed. So for example, you can ask the patient, what has been explained to you? Do you understand? Do you have any questions or concerns? So this is all helping you assess or ascertain that they've consented and that it's informed. If a consent form is required, or written consent in other words, part of your role is to confirm that it has been signed. However, you should be aware that a signed form by itself does not necessarily mean informed consent has been obtained. So if you remember what I said a little while ago, one of the criteria or conditions for consent to be valid is that you're actively making sure a patient understands. And if it's within your scope and competence, you may also be the one obtaining informed consent in some situations. So one example might be before administering contrast to a patient for a CT scan. If the patient does not have enough information to give informed consent, and it's beyond your scope and competence to provide that information, what do you think you should do? Well, one key decision, or response, I should say, is to contact the radiologist or the referring healthcare professional. So who is best to contact in this situation might depend on the nature of the question that you need the answer to. So for example, if it's an imaging specific protocol, or you've learned some other information from the patient, or they want to know more about that exact procedure, then you can involve the radiologist. If it's something about the patient's history or another test that they're having, it's maybe outside of the radiology department, perhaps the referring healthcare professional is the best person to contact. It can also be tricky to navigate this at first, which is why you will spend a lot of your time in the educational program in clinical, and this gives you a solid foundation to be able to practice independently when you graduate and learn what the resources are at your site and how to contact different professionals and who to reach for different issues. I've definitely had times where I've asked a radiologist a question about a patient history and they're like, I don't know, did you talk to the referring physician or whoever it was? And it's like, so that's a step that I realize in hindsight I could have taken and should have taken first. So it is something that's really situation dependent. I'm going to shift gears a little bit here to speak about the role of the CAMRT, or the Canadian Association of Medical Radiation Technologists. And specifically, where does it fit in terms of its role and its position as an authority? So CAMRT kind of has two prongs to it, I should say. It's a certifying body and it's a professional association. As a certifying body, the CAMRT develops the entry to practice competency profile for MRTs in Canada, and this profile is intended to set a meaningful national standard for each MRT discipline without being overly prescriptive. It also leads to the development of the certification exam. So CAMRT is the one who develops and administers the national certification exams for each of the MRT disciplines. As a professional association, the CAMRT serves as a voice for MRTs across Canada. And among the many values of the association that is offered to members, one is the professional resources that help MRTs provide a high standard of patient care, such as the best practice guidelines that we have been discussing throughout this presentation. So first I'll speak about competency and certification, and then I'll speak a little bit more about CAMRT's role as an association. You may know that the CAMRT has resources for candidates to help them prepare for the exam, and one of these is a module on how to write a competency-based exam. So I've used some of that information to help explain the next slide. As a new practitioner in the healthcare setting, you need to be academically and clinically prepared. At entry to the profession, or in other words, upon graduating, you're expected to perform in a manner that's consistent with the accepted standards of the profession. You should be able to work within a reasonable time frame, work autonomously within your area of responsibility. You also need to know your own limitations and when to seek appropriate consultation. So that means you need to be self-aware, and not only be self-aware, but take initiative to identify resources that will inform and build your practice. As you know, there's two components to your educational program, your didactic or your classroom or academic sort of sessions, as well as your clinical education. So you can also think of this as theory and practical. Theory is taught and assessed in the classroom setting, and then the skills and application of theory are evaluated during your clinical portion. So it's the application of your knowledge and skills and your behavior and practice that determines your competency in the workplace. A competency-based approach to assessment or even exam development is one that tests your behaviors as opposed to testing your recollection or your memorization of your knowledge from the textbook. So from this lens, questions are asked from the point of view of how would you use your knowledge in practice as opposed to just recalling what the knowledge is. Competencies that are examinable on the certification exam are listed in the exam blueprint. I think I mentioned that at the very beginning. And I also mentioned one that pertains to what we've been discussing today, is practice in a manner that recognizes the patient's legal rights. So as you proceed through the program, no matter what the subject is, it will become more important to consider how you use your knowledge in the care of patients. So taking informed consent as an example, earlier I asked you what criteria must be met for consent to be considered valid. So it's not sufficient to simply memorize these. First step is to memorize them because you need to know what they are. But to develop competency, you need to know what you would do, let's say, if one of these conditions was not met and you were in charge of a patient's care. So knowing the patient has a legal right to informed consent, given a list of options, which is the best course of action. So hopefully that gives you a bit of an idea of what does it mean to demonstrate competency, and not only in performing procedures, but in making decisions. So the CAMRT exam applies your theory to practice, requires you to demonstrate your critical thinking, and also make sure that you make competent decisions using professional judgment. One thing with the questions or the different scenarios that you're presented with, or different options I should say, is that it might appear to you that there is more than one answer or decision that seems possible or reasonable, but you're expected to know which is the best answer given the context. So you'll gradually develop in this area, and that's what makes this even more complicated, is that you might be seeing things in the hospital that don't always align with best practice, or at least maybe the guidelines, and different policies and procedures or ethical codes or legal requirements also have to be taken into consideration. It could be that there's a contextual factor that the MRT who made the decision didn't share with you. Maybe they assumed you knew or implied that this is what you would do in this unique situation. Or it could simply be that maybe they simply did not follow the best practice, and this is something that evolves for everyone because we're all learning and we're all at different phases of our development. And similarly, another thing to keep in mind is that society evolves. So you have to keep up with the evolving guidelines and expectations. What you learn today in school may not be how it is 20 years from now. So some of those MRTs might be operating under what they were originally taught. This is just something else to consider, as this could be a point of confusion or frustration for you as you're learning this aspect where professional judgment is applied. It's not just a technical right or wrong answer. And it's okay to question things. That's going to help you grow and learn. The last little idea that I'll touch on here is how the CAMRT drives change. And this could be through things such as advocacy campaigns, position statements, letters to the government or other decision makers. I'll also mention that some issues are national, while others fall under provincial jurisdiction. Things like the approval for medical devices such as new X-ray equipment and radiation protection issues, safety codes, fall under Health Canada. The regulation of health professionals is one area that falls under provincial, and this is what makes MRT regulation across Canada different from one province to the next. To give you a specific example that's current, a Associations are the voice of the profession. So through research and stakeholder input, CAMRT developed a position statement on the discontinuation of patient fetal and gonadal shielding. This is a recommendation only. MRTs get confused thinking just because the CMRT says something, although it may be based on the latest evidence, that they can go ahead and implement it in their practice right away. It's really important for healthcare professionals to understand the system and how new evidence is put into practice. CMRT, along with other expert groups, are working with Health Canada to make sure the safety codes reflect the latest evidence and current technology. But it's up to all of the stakeholders, policies, legislations, things like that, to also be updated, and that can take time. So the implementation of this can be a little bit more complicated than actually researching the evidence and drawing a conclusion. So CMRT will continue to work on tools and resources that help MRTs with the practical implementation, and they can also raise MRT's concerns to provincial government or health authorities, especially as the public needs to be educated on this change as well. Another issue that I've sort of mentioned here and there throughout the presentation is regulation. So that's something that CAMRT advocates for on a provincial level because the delivery of health services is provincial. The BC Ministry of Health is currently working on updating the Health Professions Act, and CMRT participates in public consultations about how their proposal affects MRTs and also advocates for the needs of MRTs. So just to wrap things up here, as an MRT, you're responsible to follow the legislation and organizational policies and procedures that pertain to your practice. CAMRT, as a professional association, can provide you with resources and supports to assist you. And they also advocate on your behalf as you experience different issues that affect your practice. So I have a couple of other messages that I want to send you off with. One thing is, what should you do if you witness something in the workplace that does not follow the code of ethics or best practice, or maybe is a breach of confidentiality or something like that? So MRTs do have an ethical obligation to conduct themselves as professionals and to report activities. So this can even include their own activities or their peers. And it needs to go to the appropriate authority when there could be a violation. So this is maybe something that's difficult to do because you don't want to be like a tattletale, but it's all for the patient's benefit, and just it's not about blaming anyone, it's just to making sure everybody's doing the right thing. There is a best practice guideline on addressing professional misconduct. So it talks about how failure to obtain consent for treatment from a patient and a breach of patient confidentiality are both examples of professional misconduct, because it's a failure to maintain the expected standards of the profession. And you can read a little bit more about what's recommended, how do you respond appropriately to that type of situation. One other thing I want to address is that you might make a mistake. It's best to admit it and to learn from it so that you don't repeat it, and then you move on and you grow. So not knowing what to do as a student is different than professional misconduct. Though you have to be careful that if you're practicing in a new procedure, or if you're dealing with a situation that you're unsure about, you must seek guidance. You should be working under direct supervision in these situations, and you must ensure that a technologist's name is documented on the case, which you should be doing at all times anyway. But you essentially take responsibility for learning what you don't know. So use your resources, find the policy, ask questions, search external to your department. It's a really good habit to get into. As soon as you graduate, you will be the one responsible for yourself. Well, you already are, but hopefully you know what I mean. And you are expected to learn these things over time and seek information on your own. So we only touched on a few issues today. I hope this gives you lots to think about, and I would like to have, or encourage, I guess because this is a recording, some questions and discussion. I'm really curious to know what questions you have. And I'm also wondering, what are some of the scenarios that you faced in clinical so far where you had to use professional judgment? So just to get your wheels turning, a couple of examples are things like a patient asks you a question you can't answer. What would you do? Or has that even happened to you yet? Maybe a technologist or a peer starts discussing the details of a case that they were involved in that you were not a part of, and this is not for educational purposes. So again, what do you do? Another one, maybe a patient signed a consent form for a biopsy, let's say, and as you're preparing the room, they tell you they're unsure if they want to continue with the procedure. Again, how do you respond? Last one, the waiting room is full, but you want to ask a patient a clarifying question about their requisition before you set up the room. What do you do? So these are the types of scenarios that I'm curious to know more about, which ones that you've experienced and additional ones that you have to add. And hopefully this helped you start thinking in a CMRT preparation or CMRT exam preparation mindset as well. So start right now. Don't just stop at memorizing the facts. Think about how you use this information in your practice. Think about alternate decisions and how that affects patient care. Seek to understand why a decision is made and where the guidance for that decision came from. And I'm going to leave it at that. I hope that you enjoyed this presentation. I did record this in the evening, so I'm sorry I tripped on a few words there, but that's all I have to say. And have a great day, everybody.